Hi, my name is Dr. Tony Salamay. I'm a doctor of chiropractic, and I have an office here in Panama City, Florida, in dealing with chronic health conditions such as fibromyalgia, chronic fatigue, migraine headaches, autoimmune disorders, chronic pain, and a whole host of other chronic health problems. I also hold a master's degree in clinical nutrition, and I have several postgraduate hours in functional neurology, blood chemistry, and endocrinology. Over the years, I realized that many people like you have been greatly underserved when it comes to finding the underlying cause of your health problem. Some of you have been to 5, 10 doctors and even more, and are not getting the answers, or haven't been listened to, or haven't been thoroughly tested for. And conventional medicine, they're great when it comes to emergency care. They're very good when it comes to blunt force trauma, heart attack, stroke. But when it comes to chronic care, they're just lost in a lost world. They treat chronic health problems with acute care, and it just doesn't work. Well, I'm here to tell you that there is an answer to your health problem. And the only answer comes when you find out what's actually causing it. I'm sure you've heard the saying, nothing ever really goes away until you find out what's causing it. Until you remove the cause, it always comes back. And our focus here at our clinic is to figure out what's causing your health problem. And the way we do this is we use cutting-edge methodology and scientific protocols in order to find out what's causing your problem non-invasively and with natural means. Today we're going to touch on the condition called fibromyalgia. Now, if you have fibromyalgia, you know what that means, which is pain, diffused pain all around the body, in the joints, in your muscles, and in your tissues. And with fibromyalgia, many patients that we see that have fibromyalgia are under pain medications. Some of them are very dangerous, like narcotic pain medications like tramadol, that are addictive. Some fibromyalgia patients are on Lyrica, which is actually an anti-seizure medication that really doesn't do anything to actually treat the actual problem. Others also, you might be put on Prozac or Zoloft or Cymbalta, which have serious side effects with the antidepressants and anti-anxiety medications. And a lot of people with fibromyalgia have problems with fatigue. In addition to the pain that they have, they're constantly fatigued. It's hard for them to get out of bed. They wake up in the morning. They're slow starters. In the midday, they may have a midday crash. A lot of them have immune problems as well as hormonal problems, and are problems with staying asleep as well. They can't get to sleep, and some of them have problems staying asleep. And with fibromyalgia, others have also may experience weight problems, may experience also blood sugar problems as well. I want you to know that we understand that fibromyalgia is real. Today I'm going to talk to you about the causes of fibromyalgia and the treatment methods that we use in order to treat you with the fibromyalgia. So I'm going to talk to you about different triggers that trigger this and that causes fibromyalgia. So first we talk about food sensitivity. Food sensitivity, we're talking about your wheat, your gluten, your soy, eggs, milk, dairy, casein, and other grains. And a lot of people with fibromyalgia have food sensitivities or food allergies. And when we're talking about food allergies, we're not talking about you eat a peanuts and you go straight to the hospital. That's not the type of food allergy that we're talking about, or you eat some type of nut and it gets you to an anaphylactic. That's called an anaphylactic food reaction. That's an anaphylactic allergy. So this type of allergy is very different. It's actually a delayed allergy. It creates chronic inflammation in our bodies, and it causes us to inflame. And when it causes chronic inflammation, that's a problem with fibromyalgia patients and a lot of chronic health disorders with other conditions, because they're constantly inflamed. So we need to look at your food sensitivities. We need to look at your corn. We need to look at your cross-reactive foods, your yeast. We need to see all of that. But what happens is, if you're allergic to any one of them, and if it shows positive, then we're going to need to remove them out of your diet. And if you're not willing to avoid those foods that are creating that inflammation, that hidden source of inflammation, if you're not willing to do that, then there's really no point on even starting, because you're not going to get well. The worst thing that I would have is for a patient of mine to start care and not get well, because that would be wasting your time, my time, and your money, and I wouldn't do that. I'm not trying to be rude, but I'm being direct with you that, if you don't have the mindset that you're willing to do what's necessary, and you're committed to your health, and if you're sick of tired of being sick and tired, and you have the mindset that I am willing to do what's necessary in order to get better from this condition, that's the person that I want to work with. If this is something that you're serious about, it's something that you want to get well, then I'm serious about working with you. And I want to personally invite you into my office for a consultation. There will be no charge for that. I'll take a look at your file, take a look at all your medical records, all your diagnostics, your lab work. I'll sit down with you, go through your history, and I'll see what we can do for you. I'll tell you basically if I can help you. Now, if this interests you and this is something that you're serious about, then I encourage you to give us a call. You can also fill out your information and get your email address. We'll also, somebody from my staff will be in contact with you shortly to set up your appointment. And I want to personally thank you for watching this video. I'm Dr. Tony Salamay, and have a great day.